Hello, everyone. I started out season 2 because I wanted to figure out what was going on with COVID 19. It seemed like our reaction to it was so much more um, excessive and disproportionate compared to the risks that it posed, and it also seemed like it was unjustified. So I spoke with a couple of professors and economists and emergency management experts in season 2, and I think that I have spent enough time talking about COVID and looking at what happened and why, um, from the lens of what was going on with our political systems, that now I think we can summarize and close this chapter. So I want to start season 3. It'll focus on crypto. But before I do that, I would like to ask and answer 4 questions. The 4 questions are as follows. 1. Were the restrictions that were brought in to react to COVID 19 justified? The spoiler is no, they were not justified. 2. If they were not justified, then why were they brought in? 3. What should have been done to respond to COVID 19, both from an individual level as well as a governmental level? And the last question is, where do we go from here? So, question 1. Were the restrictions justified? Generally, the way that I figured I would try and answer this question is by using a simplified version of the Oakes test. The Oakes test is what judges use to determine whether an infringement of a charter right or freedom is justifiable in a free and democratic society. So I figured if it works for the Supreme Court, it can also work for me as an individual citizen trying to figure out whether the restrictions put forward by government were legitimate or not. And of course, there are a whole bunch of restrictions that were brought in by governments. Not all of them are bad necessarily. I think that mask mandates were probably quite a good idea and continue to be a good idea as of October 16th, 17th, 2021. It was probably good to, actually, I think mask mandates were the only thing that was good. I don't think that any of the other gathering restrictions were good. But anyway, when I say restrictions, we'll see what specifically why they were wrong, but let's get started. So the Oakes test has 4 parts, more or less. First is to figure out what the objective of the government policy is and whether it is of pressing and substantial concern. And in this case, I'm still not sure what the government's objective has been with these restrictions and whether it is truly pressing and substantial. No government, as far as I know, has published a document saying what they are trying to do when they are responding to COVID, what their goal is, what they have in mind for when we can leave COVID. None of that. So I'm still not sure what the objective is. And as we've gone through the pandemic, we have also seen that governments have been changing their objective through time. At the beginning of the pandemic, it was flatten the curve, and our goal was to prevent the hospital system from collapsing and overflowing. Then it became slow the spread, and then perhaps stop the spread. And so there's no clear objective that governments have put forward. And that in itself is worrisome, because if rights and freedoms are being taken away, then they should have good reason. And part of that means having a clear objective in mind for what we are trying to accomplish. Otherwise, you end up with something like the war on drugs or the war on terrorism, where it is eternal and your rights never come back. For the purposes of this video and podcast, I will consider 2 objectives that the government might have had. One is to prevent the spread of COVID-19, and the other is to prevent the overflowing of hospitals with sick people. So that's their objectives. Those are their objectives. Second is, did the restrictions were they rationally connected to the outcome that they were seeking? Did the restrictions have were the restrictions that governments brought in, could they have reasonably caused the objective that they were seeking, that governments were seeking? And I would say that most of them did not, when it comes to preventing the overflow of hospitals, the breakdown of hospitals. So there are a whole bunch of restrictions, as I mentioned. One of them was the curfew in Montreal. It lasted for about 4 or 5 months, and it was at 8 p.m. It started at 8 p.m. You were not allowed to go outside of your home after 8 p.m. unless you needed to take your dog to use the bathroom or get medicine or certain exceptional circumstances. But between 8 p.m. and 5 a.m., you were not allowed to leave your home. And I do not personally see how this could, or how this prevented the hospital system from overflooding, because going out for a walk by yourself in the middle of the night does not spread COVID. Going out for a walk with your roommates does not spread COVID. Going out for a drive by yourself does not spread COVID. So that did not have any connection to preventing the hospital system from collapsing. So it was definitely irrational. There were other things that were perhaps a bit more rational. Things like closing down schools, closing down gyms and swimming pools, reducing capacity within businesses to 50 or even 25%, things like that, forbidding liquor from being consumed after a certain hour. And these were all indirect ways to try and stop the spread, but for trying to prevent the hospital system from collapsing, it's very, very indirect, and I feel like it's not closely connected. Anyway, so that's for the objective of minimizing or preventing the hospital system from collapsing. But for the attempt to stop the spread of COVID-19, I would say that let's be charitable and let's say that, closing schools and ending liquor consumption and closing down gyms and exercise facilities were things that could possibly slow the spread of COVID-19. So then the next question becomes, are the restrictions minimally impairing? And the answer to this is absolutely not, because, we went into this with David Redman. What would be minimally impairing would have been focused protection, where we protect those who are most likely to go to the hospital, and that would have been minimally impairing. Not only was our way of approaching trying to prevent the hospital system from collapsing not minimally impairing, we also failed to protect those who needed it the most, who needed the protection the most. And those were people in old age homes. I think half of our old age population died from COVID. So we failed. They were pointless to protect those who needed it the most, who were most likely to go to hospitals. But if you would like to learn about how we could have minimally impaired rights and freedoms to prevent the hospital system from collapsing, then you should listen to my episode with David Redman, where we talk about different strategies that could have been used. But from my perspective, I think that as long as we're talking about preventing the hospital system from collapsing, as long as you were rather unlikely to have gone to the hospital, your tolerance of the risk of getting COVID should have been your choice alone. So if I want to go to a friend's place and risk getting COVID from him, I should be free to do so if both of us are not diabetic, we don't have multiple comorbidities, we're not obese or overweight, we're young. Those are things that predict you going to the hospital, and those are the only reasons why it would have been justifiable to apply lockdowns to everyone, and that would be if everyone who got it ended up in the hospital, but that's not what happened. So the restrictions were not minimally impairing whatsoever, because they applied to everyone when in reality they only needed to be applied to a select few people, and we failed to even apply it to them. The last part of the Oakes test is proportionality. So is the cure worse than the disease? And the response to that is absolutely not. And this is the strongest argument that I have heard to argue against most, if not all, of the restrictions. And by restrictions, I mean things like closing down schools, limiting capacity within buildings to half or a quarter, and buildings including businesses, things like that, closing down gyms and swimming pools and recreational facilities, closing down churches, all of these things. And the answer to that, to whether it was proportional or not, to whether the cure was worse than the disease, is that yes, the cure was worse than the disease. The reason for this is because the life years that were lost through the restrictions were greater than the life years lost from COVID. And this is probably the most important takeaway from this season that I can think of. It's the concept of life years and how they apply to pandemics. We focused a lot on how many people died in this pandemic, along with how many cases there were, but those were not the right metrics to be looking at. What policymakers and governments should have done is look at how many life years were being lost rather than how many lives were being lost. Because if you have one bed and you have to choose between giving it to a 50-year-old or a 95-year-old, and you can only save one of them, it is more ethical to save the 50-year-old than it is to save the 95-year-old, because the 95-year-old has already been a 50-year-old. The 95-year-old could perhaps live for 2 or 3 more years, but the 50-year-old has not had the chance to be a 95-year-old, and the 50-year-old still has 25, 35 years left of life to live. So what governments should have been doing at every level of analysis is maximizing life years. So if you would like the specific numbers for how many life years were lost in terms of the restrictions, or thanks to the restrictions, you should check out the paper that Ari Jaffe wrote and that Doug Allen wrote. But the proportion of life years lost to the restrictions is about 5 times to 50 times greater than the number of life years lost to COVID. The life years lost to COVID come simply from the hospitalizations and the deaths. So people who were dying, you calculate how many years left they probably had, and then you compare that with the lockdown deaths. So there are a bunch of consequences that come from lockdowns that no one seemed to consider in the calculus. Loneliness, which isn't just a terrible feeling that is unbearable, but it is also something that causes chronic illness. So chronic illnesses mean that you end up using the hospital and the medical system, and you end up living a shorter life than usual. So by causing loneliness, the lockdowns causing loneliness, the lockdowns cause more of a drag on the hospital system, and it also takes away people's life years because they die sooner. So that's a cost of lockdowns in life years. Another one, a cause of lockdowns, or consequence of lockdowns, is going to be a lack of social spending. And social spending is a good predictor of life years, specifically quality adjusted life years. So we're not going to have as much money to pay for libraries and schools and social gatherings and communities and things like that, because we will be paying back the debt that we went into to respond or to react to COVID-19. And that's going to reduce the number of life years that we all have, because a good predictor of lifetime, of how long someone will live, is government spending on social programs. Another one that is very important is the loss of education. And I think this might have been a loss of education and then the choice to incorrectly ration hospital resources. Those are the two biggest costs of lockdowns, because those are the ones with the most life years lost. If you take away a year of a kid's life, if you take away a year of a kid's education, you set them back by a lot. And many kids, I would say almost all kids, are not really set up or built or capable of focusing on a screen within their bedroom for 8 hours a day. For those who can, I don't know how they do it, but there are many poor kids who just fell off the map for a year because that's what happened when schools closed. So that year of a lack of education is going to affect how long they live, because one of the best predictors of lifetime length is how much education someone has received. But not only that, it's not just education, it's also how well they can socialize with others now, and the ability that kids had to socialize with other kids also caused loneliness. So those the life years that were lost because of schools being shut down was far greater than the lives lost from COVID-19. Life years lost from COVID-19, sorry. So education was a big one, a big cost. And the other one was the delay of elective surgeries. So what was happening was, in order to make, hospitals were expecting to have a huge influx of people coming to the hospitals because they had COVID. And so what they did was they postponed elective surgeries, which it might seem like they are things that you can postpone, but sometimes if you don't get them, you die, like your pacemaker that has broken, and you need to repair it, otherwise you'll get a heart attack and die. So I think it was a big mistake to postpone those elective surgeries in favor of trying to prevent people dying from COVID, because the average age of the person who died from COVID is something like 80 years old. So that means maybe 5, 10, 15 years of life left. But the people who went in with elective surgeries, who needed pacemaker changes and cancer screenings and all of that, they must have been, they are 35, 45, 55 years old, 65 years old. And the life years that they have are far greater than the life years that COVID victims had. And so by choosing to try and save COVID victims over elective surgery people, they lost a lot of life years in the process. So we're going to have a backlog in surgeries, but we're also going to have more people die than usual in the future. And that was terrible. That is terrible. I think what they should have done was, seeing that there is a limitation to how many people they can treat, let the people who had COVID die and choose to save those with more life years instead, to choose to treat those with more life years instead. But that wasn't what they did. So to conclude that last part, the proportionality part of the mock Oakes test, I would say that no, the restrictions were not proportionate to the threat, and they were actually much more harmful than any good that they attempted to achieve. So the restrictions were not justifiable in a free and democratic society. The second question I had was then, why were they brought in if they were not justifiable in a free and democratic society? And I have two answers to this. One is that we acted like a herd. Everyone acted like herd animals, and we needed more contrarian thought, so to speak. And the second reason is something that I call pandemic populism, where the response that is most legitimate is the one that caters to the emotions of a democracy's citizens the most, notwithstanding any rights and freedoms and reason that might be there. So let's do herd thought in action. The idea behind this is you don't want to be left off of the bandwagon. You don't want to be the weird one out, kind of like Sweden. You just copy what everyone else is doing when you don't know what's going on. And how do we know this is true? Well, Jared Brown, in his cross-examination of Manitoba's health leaders, found out that the reasoning and the defense that they provided was that, well, every other jurisdiction in the world was bringing in lockdowns, so that's what we brought into. And that was their justification and defense of them. And also, Ari Jaffe, he explained that the best predictor of a country going into lockdown was not their COVID cases or anything like that, but rather how close they were geographically to a country that also brought in lockdowns. So what we see here is government leaders copying other government leaders and sticking with them rather than thinking for themselves and coming up with their own plan and using the plans that they had in the past. Now, I do think that acting like a herd animal is completely understandable at the beginning of a pandemic or in any emergency, because chances are there's more wisdom and knowledge passes quicker through a crowd when you're in a herd at the beginning. But after 3 months and 6 months and 9 months, I would have expected our responses to have been tailored to each province and jurisdiction. So that was the first reason the restrictions were brought in. The second reason is pandemic populism. And in an emergency situation, regular rules and procedures are thrown out the window. Sober second thought is thrown out the window. You just do what's necessary or what you think is necessary. And in this case, the emergency lasted a lot longer. I'm not sure if we're still under a more emergency mandate right now or not, but in this case, what happened was politicians would try and do whatever made them most popular with the people, and the people were scared. So politicians tried to be as action-oriented as possible, I guess you could say. So if the people panic and are afraid, then governments will act without much restraint in an attempt to act against that panic and fear. So they'll try and capitalize on those emotions, and if they don't, then they are seen as illegitimate. So how do we know this to be true? Well, François Legault, the Premier of Quebec, has spent millions of dollars, or around $1 million, $600,000 to $1 million on polling in Quebec. And journalists asked him about this in a clip.
Do you think the $1 million that has been spent by your government on polls since 2018 is justified? And why are you polling so much?
First, it's not $1 million. Second, 92% of the polls were related to COVID-19. Why is that? Because we needed to know if the population agree with the different rules in order to adjust them, because we had to do so in the last 15 months. And it's important that the rules be supported by the population.
Lots of people.
It's a very fragile decision each time we have to take.
federal government is...
And he basically said we had to bring in polls nonstop to figure out whether people would agree with the restrictions or not. Because if they didn't agree with them, then they wouldn't follow them. And if they wouldn't follow them, then we would have to use force to enforce them. So we wanted to find which restrictions were most permissible and palatable to the population. Which is quite a surprising thing, because what it means is that restrictions like these and tyrannies like these can only exist for as long as the populace is okay with them. So that was one thing. It's basically like populism, where you try and take advantage of all of the emotions within the populace and channel them into a specific policy. And the policy's goal is not to solve the issue at heart, which might be COVID. It is to respond to the emotions of the people. And so and this is where COVID theater comes in, really silly things like plexiglass and social distancing. I think that COVID, correct me if I'm wrong, but COVID spreads more like a fart in a room rather than little droplets that only travel 1 meter. So what matters is your exposure to COVID and your time, rather than how close you are to someone. And masks, perhaps they don't actually work at all. Going out one door in a Wendy's, but only entering from another. Shutting down water fountains. Just a whole bunch of things like that. So that's one example of politicians trying to capitalize on people's emotions. And I would say that the curfew is an example of this, the best example. The curfew in Quebec. It really didn't prevent COVID from spreading. It didn't prevent hospitalizations, and yet they still brought it in. And most Quebecers were in favor of it, around 75%, I believe, which is quite shocking. The other thing about people panicking and getting emotional is that it incentivizes politicians and leaders to be very, very risk avoidant. And this is something that I think was kind of sad to see, but medicine and medical leaders were politicized, and that was absolutely wrong to do. Because when you actually needed emergency authority to call on that, for vaccinations, for example, all of that trust had been lost. But what I'm saying here is that when the pandemic started, there was this religion that started to spread, which was trust the science, follow the science, listen to scientists. But the issue with this religion is that science can only tell you what is. It cannot tell you what ought to be. And if you are relying on things like consensus and what scientists think to respond to a pandemic, then you're not relying on science. You're relying on the thoughts of the people who do science. So I think what happened with most premiers is they trotted out their health officers to explain what the science, in quotation marks, was, because they themselves did not want to take responsibility for all of the choices that were being made. So that's one. And two is, I think also the news, CBC in particular, they were quite insistent that we should be following the science. And you see this in like hit pieces that they would deliver against Kenney and Hinshaw, that I saw once, where there was a recording within a meeting between Kenney and Hinshaw and some of their staffers that was recorded and then leaked to the press. And basically what had happened was Hinshaw gave Kenney some advice. Kenney listened to it, but didn't move forward with it. And the CBC made it seem like Kenney was ignoring science by not following what Hinshaw had suggested.
Based on recommendations from the Chief Medical Officer of Health.
A familiar phrase from Alberta Premier Jason Kenney on Tuesday. When he issued new restrictions, he said based on advice from the province's top doctor. But CBC News has obtained secret recordings from Alberta's COVID-19 Emergency Operations Centre. They reveal Kenney and his cabinet sometimes overruled the advice of Chief Medical Officer Dr. Deena Hinshaw. And they suggest politicians pushed a relaunch strategy more focused on not curtailing Albertans' freedoms than safeguarding public health. For example, on June 9th, hours before Kenney announced the second stage of Alberta's economic relaunch, Hinshaw relayed the political direction she was getting.
Essentially, I think what we're hearing, and we just want to test this with Minister's office, is they don't want us to enforce anything. They want us to educate and no enforcement.
Confidential sources tell CBC News Kenney has set thresholds to introduce new restrictions that are effectively impossible to meet. His top priority, sources say, is the economy.
The Leader of the Opposition.
Opposition NDP leader Rachel Notley says Kenney is micromanaging the pandemic response for his political base and not the broader public.
Kenney's judgment should not be used to replace the science-based recommendations in the majority of cases of our Chief Medical Officer of Health.
She called on Kenney to establish an independent scientific panel to advise the government and make its recommendations public. In the legislature, Kenney made no apologies.
I plead guilty. I have sought evidence and data to inform our challenging public health decisions and ensure that they are taken in a balanced way.
Okay, so Jenny, that's how the Premier responded to your reporting today. What did Dr. Deena Hinshaw say?
Hinshaw said she was profoundly disappointed that recordings of these private meetings were leaked to us.
These meetings should be a safe space where public servants have candid and ongoing conversations and debates. This safety and trust are now broken.
Now, Hinshaw reiterated that Cabinet has always respected her recommendations, and both she and Health Minister Tyler Shandro tried to spin this as a personal attack on her and the officials working on Alberta's pandemic response. Andrew?
Okay, Jenny Russell in Edmonton tonight. Thanks.
But this is obviously idiotic because a premier has to balance multiple things, and perhaps a medical officer of health only needs to look at the health care system, the health of the population, not other things about the population. And so Kenney responded to that, but Hinshaw specifically responded to that, and she said that she had always felt like her advice had been heeded by the premier, and it was his final decision.
The comments, as reported, are taken out of context, separated from the many other discussions that would have occurred in the days before and after, as part of ongoing discussions to ensure that my advice to the Premier and to the Minister of Health is grounded in evidence and considers every facet of potential discussions with elected leaders. This process has been violated. These meetings should be a safe space where public servants have candid and ongoing conversations and debates. This safety and trust are now broken. I have been clear that my role as Chief Medical Officer of Health is set out in legislation. My role is to provide the best advice possible to elected officials on how to protect the public health of all Albertans. I take that responsibility seriously. I care deeply about the health of Albertans. It remains my hope that Albertans understand that and respect that every conversation I have puts their health and a holistic consideration of all aspects of their health first. There are no risk-free options with COVID-19. This pandemic has challenged us all and required a wide range of complex decisions, all of which have strengths and weaknesses. I continually provide recommendations to government, often outlining a range of policy alternatives which they then debate. Once elected officials make a decision, my team works to implement the policy direction that the government has chosen. working with public health officials, Alberta Health Services, and the rest of the public service to do everything possible to limit the spread of COVID-19. I have always felt that my ideas are respectfully considered. I have always had respectful discussions between public servants and with elected officials. I do not dictate every detail of each policy decision, and I should not. I was not elected by Albertans. The final decisions are up to elected officials who were chosen by Albertans. This is how democracy works. I know that there are many views about how we should proceed. However, we are becoming divided when we most need to engage in respectful dialogue. We need to do this together for the health of all Albertans. We must listen to and consider the thoughts of others who do not agree with us. All of us want the same thing: to protect the health of Albertans, to protect our health system, and to minimize the impact this pandemic is having on everyone's lives. I have often said we are all in this together because I believe it, and it remains as true today as ever. Turning to today's numbers.
It was as if we were moving towards a technocracy or technocracy, and as if it was almost as if science was presented like some golden book out of which we could answer all of our most troubling questions, like where do we devote hospital resources, and what should we shut down and for how long. These are not at heart scientific questions. These are value questions that you answer using your values. And in the domain of values, a scientist, the views of a scientist is just as valuable as the views of an average Joe, and we must rely on persuasion rather than coercion to put forward our values as the ones that we think are correct. So, risk-avoidant politicians hiding behind the veil of science, and then also politicians seeking to capitalize on the panic and the fear by looking like people who are responding to it. The second part of pandemic populism is that the vast majority of people deeply feared COVID in an emotional and disproportionate manner. Why is this? Well, there are a couple of reasons. One is that there's the parasite stress theory of authoritarianism, which basically suggests that the more infectious diseases there are in a jurisdiction, the less liberal a group will be, and the more conservative and authoritarian it'll be. So I think the vast majority of people, for the first time in their life, had gone through a pandemic, and they wanted a result, they wanted an action to be taken, and they were okay with the government taking crazy steps to respond to the pandemic because there was an infectious disease around. The second thing that caused a vast majority of people to be irrational in their fear of COVID was, and I'm saying that they're irrational because the chances of you dying from COVID were, if you were under 50, were smaller than the chances of you dying when you got into a car crash, or when you get into a car and dying of a car crash. So that's why I think it's irrational. The second reason for why people deeply feared COVID in an irrational way is because of how quickly information spreads over the internet now. Governments no longer have a monopoly over legitimate information, and so that's because you can access multiple sources of information on the internet. Governments need to compete with other sources, and governments lose credibility in a system of competition when they appear scripted. So they for sure appeared scripted on YouTube and on Facebook and on Twitter and in all of the government ads that you saw. But the reason why it seems so fake is because the medium itself allowed for more depth And if you have a really simple 20-second message that is 3 sentences long and doesn't actually respond to an objection, when you could listen to a 3-hour episode of Joe Rogan talking about COVID-19 and its risks, then you're probably going to find the guest on Joe Rogan to be more persuasive and thought through than the 3-minute government video. So governments no longer have a monopoly over information, and it seems like the way that health communication has been developed it's been developed in a world where governments did have at least the potential to have a monopoly over information, like over radio and newspapers and all of that. The other thing about social media and the internet is that emotions spread far more quickly, like fear. They spread far more quickly than reason and proportionate thought and data, understanding data do. So, we saw this in the George Floyd video. It was one black man who was killed by one police officer, but it lit the world on fire. There were protests in every major city against police brutality. But that's just one person. Why is everyone getting so upset? Shouldn't people get more upset with every marginal person who dies? Sorry. So that made no sense to me. Well, it does make sense, but the point that I'm making here is that the internet facilitates the spread of emotional thought, and it generally leaves behind content that is not emotional and to wither and to spread more slowly. And I think the fear of the pandemic, the unknown unknowns, and the lack of communication from governments at the beginning, a lack of understanding of what they were doing because they weren't sharing their reasons for not closing down the border, for not mandating masks, for not sanitizing, things like that. That lack of transparency caused a lot of distrust as well, which was filled by emotions from the internet and an extreme fear of catching COVID, because people didn't have any information to replace it. So that was the second question, which was why were the restrictions brought in? Because of herd thought and because of pandemic populism. The third question is, what should have been done? I'll start with governments because it's a bit more easy. From my perspective, at least, I think the governments should have written out and published an articulated plan with an objective and justification for what they were trying to accomplish and why, and what everyone's role was in this pandemic. And this is what David Redman talked about. I think that was exactly what we should have had and what I am still waiting for. Another thing is a cost-benefit analysis of the restrictions. This one really surprised me because I would have thought that by now governments would have written a cost-benefit analysis of the restrictions, but they haven't done so. According to Jared Brown in our podcast together, he found that no Manitoba government official had done a cost-benefit analysis. They had done a harms-benefit analysis, but that's just healthcare specific. It's not an analysis of the economy and the dollar value of everything. So they should have done one. And if they had done one, they would have realized that the costs of lockdowns far outweigh the harms, or the benefits, sorry. So that's the second thing the governments should have done. Third is they should have taken more political responsibility. And this is what I was mentioning earlier. Governments gave away way too much authority to health care leaders and quote unquote the scientists. And this meant that they failed to make the appropriate trade-offs and choices that were difficult and perhaps dirty. Things like choosing to do cancer screenings instead of protecting people with COVID. Things like focus protection. Things like pointing out life years instead of lives. These are all things which are quite difficult to do because of the insane amount of social pressure that would be directed towards you, and the mobbings on Facebook and social media and Twitter. But those were the things that were necessary in this crisis. So that's for governments. 3 things. Write a plan, write a CBA, and take more responsibility. For individuals, maybe that I should have started with that first. I think that individuals should act panicked, but be deeply suspicious of governments and expect the highest in terms of rationality from them. You should expect cold system-based rationality from governments. And this is something that I regret, because at the beginning of the pandemic, I panicked, and I was also excited as well to see what would happen, to see whether the world was going to flip upside down, to see what would change. And I was prepared to, it felt like we were all in this together, and we were all preparing for a great challenge. And we all were excited and ready to do what we could to help address this pandemic. And what that meant was staying at home. But yeah, so I regret giving away my rights and freedoms willingly at the beginning of the pandemic and saying to governments, more or less, you can do with them what you need to do. We trust you. Because once you give them away, they don't come back easily, if they come back at all. I think that individuals should have panicked, but not governments. And what ended up happening was individuals panicked, governments saw it, and governments panicked too. When I say panic, I mean act in self-interested ways. So things like buying toilet paper when no one else was buying toilet paper. Because if there's a shock in the supply, then you don't know what's going to happen. Another thing is buying canned food. You prepare for the worst and hope for the best. A third thing is wearing masks. Common sense suggests that masks actually work and they protect you. The precautionary principle also suggests that you should wear masks or a bandana if you don't know whether they work or not. And I think that only someone who was panicked would wear a mask, or who's acting in a self-interested, panicky, precautionary way. So the individual should act like that, but governments, not as much. So the precautionary principle works better at the individual level rather than at the governmental level. The precautionary principle applied to citizens from a governmental level mean you lose all of your rights and your freedoms. Perhaps, I saw this online from Paul Joseph Watson, perhaps we're going to have curfews for men between 10 p.m., 9 p.m., and 6 a.m. every Friday night, because every man is a potential rapist. Or perhaps we have no driving after 10 p.m. because every person is a potential drunk driver, just like how every person is potentially sick with COVID and can infect you. So it's not good to use the precautionary principle from a governmental level, but from an individual level, it might be better. So, not going out on the roads at night because you don't want to be hit by a drunk driver. There is some sense in that. Or being extremely cautious when you are outside at night as a driver. So I regret panicking, and that's why I say that you should act self-interested in the way that a panicked person would, because panic and going along with the herd has gotten the human species very far through evolution. It hasn't been thinking by yourself and thinking rationally and soberly that has gotten us through all of these years. So I think that individuals should panic or act in a panicked way, but not governments, not systems. The second thing that should have been done was, and still is, for people who want to think like contrarians, who want to think independently, is to have and to use first principles. This is a lesson that I learned the hard way. I think that I supported the restrictions at the beginning of the pandemic in part because I was following so many libertarians on Twitter. And so for me, my social environment said that the restrictions were wrong. And being a contrarian, what I simply did was take the inverse of what I saw the social environment to be saying, which is that the restrictions were wrong. So I said the restrictions were right. But the issue with that, of course, is that you then end up having to depend on a group of people to think for yourself. And then that's not really thinking for yourself. So the solution that I found to this is to have first principles and then to use them and to reason deductively from those first principles so that you come up with a conclusion that you can stand by and agree with, that you come to independently. So an example of these first principles would be the cost-benefit analysis of Doctors Allen and Joffe on this podcast. It's quite clear. It's quite straightforward. Another example of first principles thinking would be the Oakes test applied to the restrictions, where the steps to prove something are quite clear. So if you want to try practicing this yourself, you could say, what information would change my mind? What information would I need to see? What would I need to read? And then is my thought dependent on certain facts, or is it dependent on the social situation around me? So for example, with the vaccine, am I not getting the vaccine because I don't trust the government, or am I not getting the vaccine because I need to see data that is X, Y, and Z? So once you set your standards for changing your mind becomes less subjective and less dependent on the thoughts of the people around you. So that's what using first principles are. Yep, so that's what should have been done. Panic at the individual level, expect cold, systematizing rationality from governments, use first principles, and governments need to write a plan, write a CBA, and take more political responsibility. So the last question that I wanted to ask and answer was, where do we go from here? I think that I, for one, feel quite alienated from my country. I'm shocked that Canada has become like this. I'm shocked that we would bring in vaccine passports. I'm shocked how most people seem to be going along with them, and people are okay with the restrictions and all of that. And I feel alienated from my fellow citizens. I feel like this isn't the great country I thought it was. I feel like we don't really value rights and freedoms here much at all. And as we went through earlier in this episode, we didn't really do a great job of protecting life years. So where do we go from here? Well, in this podcast, at least, I'm going to be trying to figure out what this new environment is that we're living in, because there have been structural changes in the last 15 to 20 years that have caused acceptable political thought to shift from what it used to be maybe 25 or 30 years ago. I don't think that mobbings were acceptable in the Western world 25 to 30 years ago. So neither was cancel culture. So what I'm going to try and do is to figure out how to adapt to these structural changes and to figure out what they actually are. So just to give you another example, with all of this gender bender stuff and the pronouns and all of those questions, where does that come from? you could say that postmodernist university professors are teaching kids to that their identity is infinitely malleable, blah, 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 blah. But the issue with that is that kids who are younger than high school now have pronouns that they put forward on their bios that are not he, him, or she, her. This is a phenomenon that comes from internet culture, where what you say goes. You can be a gender that is between male and female, or man and woman, and you can also be one that is completely out of the spectrum. You could also be an attack helicopter. And that's all possible on the internet. Now, we of course run into issues where the real world touches the digital world. Perhaps gender-neutral bathrooms aren't the most fun to be in, and gender-neutral change rooms and gender-neutral everything, but the reason why this isn't going away is because the internet is not going away. So what I'm going to try and do is figure out the structural changes that happened in the past couple decades, and then figure out how people who believe in Western values can adapt to them. So, for example, mobbings, cancel culture. That isn't something that happened a while ago, but I think it's happening because social media facilitates it. The solution to this is not to say that they're bad or unjust, even though they are. The solution is pseudonymity, to separate your working identity from your personal identity, from your government identity, from your shadow identity on Reddit. And that way people will address your ideas rather than your person. Another issue is 51% democracy versus 100% democracy. I said earlier that I feel that the restrictions were absolutely unjustifiable and crazy and asinine, but I have many friends who think that they were entirely reasonable and justified. And then I have dealt with strangers on Twitter who think that someone who thinks what I think is evil and inconsiderate and so on and so forth. And so what ends up happening is we try and share power, or we take turns in power, and so perhaps for 4 years the people I support will be in power, and then for 4 years the people they support will be in power. And this is what Balaji Srinivasan calls 51% democracy. And there's always going to be 49% of the population who feels like they're being tyrannized. So the solution to this is to subdivide down into groups until we have 100% democracy. We used to, the idea behind nation states was that the people who we lived beside were people we would agree with, and then that stopped when the internet came out, because now I can perhaps agree more with a Bitcoin maximalist based in Russia than I can with a social justice warrior who lives right beside me. So I think the solution to 51% democracy is to continue to break down the social group until you have a social group that is completely consensual, and Bitcoin facilitates this. And so do online communities. And that is the solution, using the technology that is new to respond to mass coercion. So we would create a community, and then perhaps we would create a currency online, and then if numbers get big enough and wills get insistent enough, we could negotiate land with the government. So we shrink the size of the social unit to respond to this issue of 51% democracy. And one thing that really stood out to me in the past few months was Balaji Srinivasan's arguments for crypto and the network state. Srinivasan is a angel investor, an entrepreneur, a mathematician based in the US, and he's extremely persuasive. And the argument that he put forward was that crypto and the network state are actually the solution and the way you protect Western values. It's no longer centralized institutions like governments and Canada and the US. It's decentralization. That's because you have the core liberal values in decentralization. You have consensual government, 100% democracy. You have private property on the blockchain, where once something is on the blockchain, it's not coming off. It is etched into stone. And you can tell that something is truly yours, that JPEG or that PDF went from this person to that person, and that is the original PDF. And you also have freedom of speech because you are uncancelable on the blockchain. So because of Balaji Srinivasan's arguments, I think I have been inspired to look into crypto and to understand its potential. And so that's what I will be doing in large part for season 3. I'm going to try and understand the world of crypto. I'm going to try and understand it through skin in the game, because if you were trying to explain what the internet was by explaining how flashes of light travel through fiber optic cables that go across the world, you wouldn't really understand what the internet can do. The way that you understand the way you explain the internet to someone from 2,000 years ago is you tell them what it makes easier, how people use it. And so for me, I use it to connect with friends. I use it to do banking. I use it to find sales at the grocery store. I use it to share information. So I'll try and be purposeful in my explanations of things, and I'll also try and learn by using skin in the game. So I think skin in the game learning is the best way to learn something. So Bitcoin, for example, the best way to learn about Bitcoin is to buy some Bitcoin, $20 worth on a currency exchange like Newton, and you'll want to learn about it as your fortunes rise and fall through time. That's how I started to learn about it. So in every episode, I'm going to try and have a homework assignment that you can do for yourself to learn about a specific thing. And so that's what the goal will be. It'll also be to get wealthy. One last point that I will have to do away with is having special seasons where I focus on COVID policy or where I focus on crypto. And that's because I just cannot maintain that for a long time. It's too difficult to get all of the people at once in to record with. So it'll largely be about crypto, but no promises. I might have a guest talk about dating and relationships or something like that. So that's what the future of Letters from a Contrarian will be. It'll be an eternal season 3. We're good. Thanks for listening.